MMT, ankle dorsiflexion and inversion, tibialis anterior. Assist the patient to the short sitting position. Sitting on a stool in front of the patient with the patient's heel resting on your thigh. The patient's knee is partially flexed. Passively move the patient's ankle through dorsiflexion. You're not assessing the infield, you're determining how much range the patient is able to move in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to dorsiflex and invert the ankle as you observe for any substitutions. Stabilize the patient at the posterior leg just proximal to the ankle. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include using the extensor digitorum longus and the extensor hallucis longus muscle that will result in toe extension. You must instruct the patient to keep the toes relaxed. Make sure the patient's leg does not go into hip flexion or that knee flexion increases any more from the initial position. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient at the posterior leg just proximal to the ankle. The hand providing the resistance is cupped over the dorsal medial aspect of the foot. This hand will apply the resistance in a downward and inward direction toward the floor. Apply the force for a 5-second count. Grade 5, normal. The ankle dorsiflexed and inverted to the available range of motion, and the patient was able to hold the in position against maximal resistance with no break in the position. Grade 4, good. Ankle dorsiflexed and inverted to the available range of motion, and the patient was able to hold against strong to moderate resistance. Grade 3, fair. The patient is able to move through all the available range of motion in ankle dorsiflexion and inversion, but is unable to tolerate any resistance. There is no position change for grade 2, 1, or 0. Grade 2, poor. The patient completes partial range of motion. Grade 1, palpate the tendon of the tibialis anterior on the anteromedial aspect of the ankle or about the level of the malleoli. With the other hand, palpate the muscle over its belly just lateral to the shin. Grade 1, trace. There is palpable contractile activity in the muscle or the tendon, but there is no joint movement. Grade 0, no palpable contraction.